This is KTVO's Good Morning Heartland.
And welcome back. In its first 5 years, the Affordable Care Act has survived technical meltdowns, a presidential election, 2 Supreme Court challenges, including one resolved last Thursday, and dozens of repeal efforts in Congress. But its long-term future still isn't ensured. Dr. Justin Puckett from Complete Family Medicine is here this morning to talk more about the 5 biggest hurdles that still remain. Good morning. How are you doing?
Doing well, thank you.
So the first one we're going to talk about is the Medicaid expansion.
Yeah, as many people in Missouri know, we haven't expanded Medicaid in Missouri, and that was a part of the expectations of the Affordable Care Act. And over 20 states haven't done that, including some rather large states, Texas, Florida, and then, of course, Missouri included in that as well. And so what that's done is it's left a group of people who are under the poverty line that don't qualify for existing Medicaid. And there were some federal funds that were intended to help expand Medicaid up to near the poverty line. But many of these states, of course, the states have the opportunity to manage their Medicaid program, and so they get the opportunity to decide if they're going to expand or not. And in Missouri, we have a balanced budget amendment, and so even though the federal funds are there to get started by making a big increase, there's just lots of political turmoil about budget issues, and are we going to be able to maintain something if once the federal government dollars kind of start to slip away? And so at this point, there's in a Republican-led House and Senate at the state level, it's not looking very good for Medicaid expansion in Missouri.
Okay, now let's talk about enrollment. Now, is that an issue as well?
Yeah, there's been some problems with enrollment. They've really had trouble reaching out to Hispanics, to young adults, and also to people who just are turned off by the concept of being forced to buy something. And so there's that big group of people, somewhere around 18 million people who are eligible, who've been on the website, who've maybe looked around, but have just never pulled the trigger to actually engage and to purchase health insurance. And the monies to advertise and promote and get those folks to the marketplace have about dried up. And so it's going to be interesting to see what happens with those folks. But the fee goes up this year. Starting next year, it'll be $695 or 2% of your family income if you don't enroll in some form of health insurance.
Wow. Now let's talk about market stability. What does that have to do?
Well, the market stability is something that we haven't seen any major changes in the premiums that are being paid. Now, what we have seen some changes in, especially on the employer side or the commercial side of insurance, is changes in benefits. And so deductibles have creeped up, coverage limitations have creeped as well. But as far as the actual dollars being spent per employee across the nation, that we haven't seen those numbers go shifting crazy like there was some concern. However, the federal government has kind of leaned up against that and provided some buffer zone and provided some monies to help prevent those big jumps in reimbursement. And so once those dollars go away, it'll be interesting to see what's going to happen with some of these premiums.
All right. And speaking of premiums, and you just said, starting next year, it's going up. So the next hurdle that they're facing is affordability. Yeah.
And, even getting on the marketplace and getting affordable care insurance, there are other limitations as well. In Northeast Missouri, there is very limited access to providers who accept one of the plans, the Blue Cross Blue Shield Obamacare plan, primarily because Blue Cross Blue Shield has just not been able to offer a contract that anyone was willing to accept. Now, there is some access with the Federally Qualified Health Center, and then most hospitals and those sorts of things will accept all of those. But as far as physician offices is concerned, very limited access to that. So we only have 2 plans here. So the Coventry plan is widely accepted, and they've just opted to, when they rolled out their version of Obamacare, to just pay on the same fee schedule and use our existing contracts. And so at this point, we're hoping to get hoping to see increased access there, but also the amount of money that is being pushed towards the consumer is increasing. So next year will almost be $7,000 per individual and almost $14,000 per family. Not all of the plans have those high deductibles, but many do. And so having that insurance may be there for catastrophic needs, and that's going to be helpful. But on the day-to-day needs, it's going to be a bit limited. Although I would encourage everyone that that even those plans with high deductibles cover preventative medicine. Anything that's recommended by the United States Preventative Task Force, they cover it 100%. And so you need to at least be getting to the providers and getting that preventative medicine done, even if you're not sure that you're going to be able to do more that might be diagnostic. Don't let that limit you. Get checked out and make sure that there's not something else going on that you need to be seen for.
All right. Well, thank you so much, Dr. Puckett. What we'll do is we'll post everything on our website at heartlandconnection.com. And we'll also link up Dr. Puckett's information with Complete Family Medicine if you have any questions or concerns. Again, thank you so much.
Thank you.
And we'll be right back.